In Wisconsin, a woman had an incomplete miscarriage. She bled for more than 10 days after emergency room staff would not remove the fetal tissue from her uterus. They were afraid they could be prosecuted if they did so under a law banning abortion that is now in effect in Wisconsin. Doctors at a hospital in Michigan found themselves treating a woman from out of state. She had had to cross state lines to get care for a life-threatening ectopic pregnancy. An ectopic pregnancy is never viable. Doctors say that it could have caused a rupture at any moment that could have killed this woman, but a doctor in her home state worried that the presence of a fetal heartbeat made a procedure to remove it illegal and wouldn't do it, even though it risked her life. In Louisiana, a doctor described treating a patient whose water broke at 16 weeks. The fetus was not viable. Continuing the pregnancy at that point would put the woman's life at risk. The patient wanted her doctor to perform a common 15-minute abortion procedure, but the patient was told that under Louisiana's new law outlawing abortion, she would have to have an induced delivery instead. In an affidavit filed in court, the doctor said her patient, quote, was forced to go through a painful hours-long labor to deliver a non-viable fetus, despite her wishes and best medical advice. Quote, she was screaming not from pain, but from the emotional trauma she was experiencing. And then she hemorrhaged nearly a liter of blood. The doctor said, quote, there is absolutely no medical basis for my patient or any other patient in the state to experience anything like this. This was the first time in my 15-year career I could not give a patient the care they needed. This is a travesty. One OB/GYN in Texas described a recent patient who had started to miscarry and developed a dangerous infection in her womb. The fetus still had signs of a heartbeat, though, so an immediate abortion, which would be the usual standard of care, that would have been illegal under Texas's abortion ban. The doctor said, quote, we physically watched her get sicker and sicker and sicker until the fetal heartbeat stopped the next day, and then we could intervene. The patient developed complications, required surgery, lost multiple liters of blood, and had to be put on a breathing machine, all because we were essentially 24 hours behind. Those are just a handful of the stories that doctors have been willing to put on the record about the practical consequences all over the country of the Supreme Court overturning the right to an abortion. It is not theoretical. It is happening now.